and welcome. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy. In today's video, we're going to be showing you how to perform the skills that are needed in order for you to pass the Prometric CNA examination. I'm based out of Florida, so if I'm showing you something that is different than what your instructor or your school has taught you, then of course I need you to go by your formal instruction. And then also, disclaimer, the training that we're providing here today does not substitute a accredited CNA program. It's to help those who are ready to take their test, just to review their skills, and also we have playlists with multiple practice questions. If you're in Jacksonville, Florida, and you actually want to come to our facility to learn the hands-on skills, we have the CNA exam prep courses, which are 2 days, and they are great for pre-med, pre-nursing students. It lets you get in, focus on your skills, and the majority of our students pass on their first attempt. All right, so let's get started. The skill that we're going to be showing you right now is going to be perineal care. And perineal or perineal care can be performed on both men and women. However, for the state of Florida examination, the skill is performed on a woman only. And we're going to begin with our normal procedures. We've provided privacy. We've washed our hands, and now we're going to don gloves, which means put on gloves. And of course, we've already told the patient about the procedure and what we were going to do. So let us begin. All right, so I'm applying gloves to my clean hands, and I have my supplies. I have my table here that has towels, washcloths, a bed pad, a bath basin with warm water, and then also soap. For the state of Florida exam, we begin by actually changing the bed pad that's beneath the resident. You would not do this in the real world. You're only doing this for the state of Florida CNA examination. I have the rail down on the side nearest me. I'm going to remove this call bell because I don't need it. I'm right here with the patient. Whenever you're maneuvering someone who cannot turn themselves, it's a good ideal to move their body incrementally. And then I'm also preparing the pad in advance. So I'm going to roll it halfway in. So I have everything I need. Now I'm going to move my patient towards me for safety. Shoulders, hips, and then legs. I am going to expose her a little bit more than what I normally would, but remember the curtain's already pulled and that I'm doing this for classroom or for teaching purposes. And now I'm going to turn my resident. The easiest way to turn the resident is by bending or crossing the leg nearest you and then going and using the large joints, the hips and the shoulders, and the hip and the shoulder, and turn away from you. Just going to reposition my patient to make sure she's okay. Are you okay? I'm going to roll this pad in. I'm going to apply a new pad. All right, making sure the pad starts off at the upper hip level. Push it through. Trying to make sure there's no wrinkles in it. And now I'm going to lay my resident back down. Only for the state of Florida examination would you change the pad before you actually cleanse the resident, but that is what's required for you to pass the test, and our goal is for you to pass the test and not overthink the process. If you are tall enough, you can just simply unroll, take out the dirty, put it in the laundry basket, the dirty, put it in the trash can. Roll out the rest of your pad, and then re-center your patient. I'm going to expose you a little, and let me cover up your legs for warmth. All right, so whenever you're cleaning a woman, you want to clean the outer folds of the labia, the opposite fold of the labia, and then go down the center. Because we're only cleaning a mannequin, technically it's already clean, so we're only going to do 3 wipes. But in the real world, you would wipe until your resident was 100% clean. So if you're at the test site, you want to have your nurse test the water temperature. If your water had gotten cold because it took you a while to change the pad, you may want to put this rail back up, cover your patient, and then go get fresh water. When you're preparing your washcloth, fold it into an eighth. So when I pick it up, it's already folded, so it's folded into a quarter. Pick it up and, fold it once more. And then every time you wipe, you just peel a layer, and peel a layer. Every time you wipe a woman, you're supposed to use a different spot on the washcloth. So it'll make sense in a few moments. I'm going to wet my washcloth, wring it out very well. I don't want to have to change my new pad that I just placed, so I'm going to be drying my gloved hands on the towel that's on top of the table. For the state of Florida examination, we do not put soap directly in the basin. We apply 1 drop of soap to our washcloth, and I'm going to wipe the outer lip going down. Change positions, even though it's no soap on that part of the washcloth, because I put the 1 drop of soap, it counts for the entire washcloth. Don't overthink the process, just pass the test. And then I'm going to wipe down the center. So I cleanse by going down, front to back. I did one side, outer. I repeat the process on this side, outer, and then I wipe the center. And now I'm going to rinse the same exact way. Are you still doing okay? I'm almost done. All right, so this is our rinsing cloth. I'm going to dry my hands so that my pads do not get wet. I'm going to find the corner that I'm going to be pulling down. And how do I wipe? You're correct. Outer, outer, center. Always wiping down. Whenever you get your new towel, don't let it touch you. And I'm going to dry the same exact way. I'm drying you now. Outer, outer, center. I'm going to reuse this towel for her rectum and her buttocks. I can now cover up the front of my resident. Okay, I'm going to have to turn you in order to clean the back of you, okay? We're going to turn. Remember what we did last time? You came towards me. I'm going to uncover your legs so they don't get caught. Make sure your arms out. I'm going to cross your leg. All right, now I'm going to turn you on the count of 3. 1, 2, 3. Get you repositioned. Get you off your arm. I'm going to cover her for warmth. Try to make sure your legs are not touching the bed. And now whenever I clean the resident, I'm going to still continue wiping from front to back, from cleanest towards the dirty area. We're going to get another washcloth. So now I'm on my 3rd washcloth. I'm going to wet it, wring it, dry off my hands. And remember, for the state of Florida examination, how much soap do we apply on our washcloth? If you said 1 pump, you are correct. I'm going to wipe towards the back. I just wipe the rectal area. I'm going to change spots on the washcloth. I'm going to wipe this buttock up, flip the washcloth, wipe the other buttock. Of course, if this was a human, every time we wipe, we'd see residue. So we would know if we were using the same spot twice. So again, for your CNA exam, don't overthink it. Just remember to check your water temperature to make sure you don't wet that pad, to keep wiping in the correct direction, and to wipe all the areas that you're supposed to wipe for perineal care. You also have to communicate with the resident, and the nurse will answer on behalf of the resident. So far I've washed, I just rinsed, and now I'm going to dry. And for the buttocks, you can use the back or the palm of your hand. I tend to use the back of my hand only because I've worked in psych, and some of those patients can say some strange things to you. And so if you're in a facility, they may have bud paste or different types of ointments that you could apply to your resident, but for the state of Florida examination, that is not a requirement. Make sure there's no wrinkles behind your patient. That even includes the gown. Okay, I'm going to lay you back now. We always want to keep our residents aligned. So you're going to reposition him or her back, reposition her back into the bed. Straighten out her gown. Remove any wrinkles. Take off your gloves. I can then let this roll back up, clean my supplies, re-glove if I need to do any other procedures in the room, and then don't forget that before you leave, make sure the patient has the call bell, rails up, curtains open, wash your hands, and you're done with your skill. All right, so this has been Eunice Mathis, practicing perineal care. I hope this helps you. If you like our videos, go ahead and like this actual video, subscribe to our channel, and if you pass your test and our videos helped you, please leave a comment and let us know. We appreciate you and we wish you the best. Bye-bye.